we really welcome all of the innovation we've seen around the world in both repurposing older drugs or drugs that are used for other indications and putting them into trials to see what impact they will have on COVID-19. We are also very grateful for all the investment and work going on for developing new molecules that may prove ultimately to be effective in the treatment. And we maintain a global database of all of those drugs and all of those trials. And we're encouraging all innovators to work through their national regulatory authorities, their national institutes of health, to ensure that any trials that are commenced with proper support and proper authority, proper ethical approval. And Africa has a strong track record in doing such work, and I'd like to congratulate the institutions in DR Congo especially, and Jean-Jacques Boyembe and his staff, because we have a monoclonal treatment which is highly successful for Ebola now, and that was developed in Congo with collaboration with NIH in the United States, but has been one of the first proven therapeutics against Ebola, a life-saving intervention developed in DR Congo and has been used successfully to treat in the last outbreak. Again, there is a tremendous amount of innovation going on in Africa in general. Maria mentioned South Africa, and again, it is interesting the way in which South Africa is bringing the disease under control, and how African countries are actually in some ways showing the way. The strategy in South Africa was based on preparation, primary prevention, lockdown and enhanced surveillance. 67 mobile lab units around the country, 28,000 community health workers trained in case detection, and I think over 120,000 tests completed with a 2.7% positivity rate, which is incredible, that much testing for that return. So we're seeing performance levels there again, congratulating the government and institutions of DR Congo for the superb way in which Ebola has been brought under control. We still have some way to go. So I think in general, we need to leverage the capacities that exist in Africa, the innovation, the science. We need to connect those scientists, we need to connect those laboratories, those clinicians across Africa. Again, the Director General, working with our Regional Director, Chidi Moeti, and the African Union, have been heavily engaged in trying to drive innovation, both in the public and the private sector across Africa. And it will be very important that studies in Africa are led by principal investigators from African institutions, and obviously reaching out to collaborators in other parts of the world. And I trust that those capacities exist. And again, to point to the rapid evolution of capacity. At the beginning of this epidemic, and I will point to the fact that WHO began distributing validated testing kits in Africa on the 24th of January, which was 7 days, 8 days a week before the declaration of the global public health emergency. But it was the laboratories at Institut Pasteur in Senegal and NICD in South Africa that trained all of the laboratory technicians from all over Africa, who then met up with their new reagents when they returned home. We're also seeing the use of high-throughput diagnostic systems in places like Kenya, where superb technology that's been provided by the Global Fund and others has been repurposed to use for high-throughput diagnostics in many African countries. We're working very closely with the Global Fund, with UNICEF, with UNITAID, to accelerate the availability of reagents for those high-throughput systems. So I think we're seeing very, very good things happen, but we're very cognizant of the challenges. We've seen almost 250% increase in cases in Sudan in the last week, in Somalia nearly 300%, and in many other countries like Tanzania, Mali, Congo, Gabon, Equatorial Guinea, Capo Verde and Eritrea, increases of more than 100% in the last week. With many other countries in Africa, case increases somewhere between 30 and 90%. So We are at the beginning in Africa. I believe that with a focus on preparation, on surveillance, on community mobilization, and on the undoubted capacity for innovation and science in Africa, that we can avoid the worst of this pandemic. But we are also cognizant, as the DG said, that there are lives and there are livelihoods, and the impacts of long-term lockdowns are having a severe impact. So we have to find a way forward in Africa that can balance the risk of the virus against the risk to people's livelihoods and people's lives at the same time.
Thank you very much, Dr. Ryan.